Hello, I'm Emily Jesper-Meir. I'm Strategy and Engagement Manager at Understanding Patient Data.
And I'm Rebecca Asher, Emily's job share partner.
So UPD's aim is to make the way patient data is used more visible and trustworthy for the public. As part of this, we commission attitudes research and public engagement to understand people's views about data use. In this presentation, I'll share some of what we've found out through this work. In our experience, if you take the time to talk with people about data use, it pays off through the insights that you find out. How can you get conversations going? On the face of it, data can seem dry and abstract, but if you make the effort to relate it to stories and debates that are already happening out there in the public conversation, or to people's own experiences, they often then have questions and want to dig deeper. When people are given clear information and an opportunity to discuss it, they want to engage in tricky questions and to be involved in discussions about how data is used. For example, in our Foundations of Fairness research, we commissioned citizen juries. They looked at knotty issues like, what is the public benefit of data use? What conditions should be set for use of NHS data by commercial organisations? It's worth putting in the time and resource to engage with people. When you do, you can get rich insights to inform policy and practice. This way, people feel the time they spent with you is valued and going somewhere. When you start that conversation with people, there are a range of initial reactions. People can be frustrated at the lack of data sharing when it comes to their own health. For instance, this person, I would assume the information they have at the GP, the hospital can see it too. It is exhausting because you're in so much pain and still need to explain it. Alongside frustration, there's another reaction, apathy. People can think data's boring. On the other hand, some people already come to the issue with lots of questions and concerns. The pandemic has increased public awareness and engagement in data use issues. Just before the pandemic, 63% of respondents in our research were unaware that the NHS granted access to data for research for charities and industry. But in the National Data Guardian survey a few months later, more than half of survey respondents agreed that during the pandemic, they had learnt more about how health and care data can be used to monitor public health and for research. And there's more information on people's attitudes on data use following the pandemic in the Confidence in a Crisis report from the Ava Lovelace Foundation. Over to Rebecca.
Thanks, Emily. When you do take the time to discuss with people how patient data is used, they're often generous and want the system to learn from their experiences. So here we've got somebody saying that they would be more than happy to share that information and that they see it as for the greater good. So for many people, if not everyone, learning more and being able to ask questions helps build support. For example, people are generally comfortable with patient data being used provided there's a public benefit, and they want to know that benefit will be shared across the country to avoid making health inequalities worse. But people do have concerns over commercial exploitation of NHS data, and they're sceptical that the NHS will be able to effectively use data. People have concerns about lack of in-house technical capacity and expertise, and they place a high priority on independent oversight, transparency, and accountability. People want to know safeguards like data security and anonymisation of data are in place. NHS data is highly valuable. The public are not completely opposed to the NHS making financial gain through commercial data use partnerships. However, they are clear that value must always come back to patients. In Foundations of Fairness, juries also argued that there was a risk that the NHS would focus on short-term financial incentives when entering into commercial partnerships, rather than long-term benefits for future generations. They also made the point that getting value out of commercial partnerships isn't just about money, but includes factors such as health improvements too. The public want to be involved, as this quote shows. Our message is, involve people. The public want to have their say, and they should have their say. Put public attitudes at the heart of data policy. If we design data use around public attitudes, we can build a system which is more worthy of public trust and ultimately much more resilient. But it's vital to have a rounded and granular understanding of what the public thinks. Currently, there's a lack of understanding of demographic differences. And this is one of the reasons why UPD has commissioned an engagement project with Black and South Asian members of the public. So while placing public views at the heart of policy and practice, it's important to bear in mind that attitudes do differ. There's no definitive public. Attitudes also change over time as technology develops or in response to external events, such as the pandemic or data breaches. Ultimately, transparency coupled with listening to public attitudes is the key to building trustworthy and resilient data use. And there's lots more information on our website, including case studies, blogs, and visual resources.